this is Dr. Duret Hassan, reproductive endocrinologist and infertility specialist in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family, here to talk to you today about recurrent pregnancy loss. Recurrent pregnancy loss is defined as the loss of 2 or more clinical pregnancies. A clinical pregnancy is a pregnancy where we saw the pregnancy in the uterus on the ultrasound, but it failed to continue growing, or we have a pathology report indicating a pregnancy loss. The most common known cause of recurrent pregnancy loss is aneuploidy. Aneuploid embryos have an incorrect number of chromosomes or gene regions and therefore more likely to result in a miscarriage. Another common cause of recurrent pregnancy loss is uterine abnormalities. There are 2 different types of uterine abnormalities. There are congenital uterine abnormalities. These are uterine abnormalities that a woman may be born with. And then there are acquired uterine abnormalities. These are uterine abnormalities that a woman is not born with, but she may develop at some point in her reproductive history. Congenital uterine abnormalities include septated uterus and bicornuate uterus. A septated uterus is a uterus where there's an avascular membrane or septum dividing the uterus. If an embryo implants on this avascular membrane, there's very minimal blood supply to that embryo, and that can result in a miscarriage. A bicornuate uterus has 2 horns and smaller cavities. Acquired uterine anomalies include things like uterine fibroids. Uterine fibroids are benign, non-cancerous growths in the uterus. These fibroids can cause severe pain and bleeding, and they can also distort the uterine cavity and make it difficult for an embryo to either implant or can result in a miscarriage. Uterine fibroids can be removed surgically. Another acquired form of uterine abnormalities include intrauterine scar tissue. Intrauterine scar tissue can develop from previous pregnancies, previous infections, previous surgeries. These scar tissue can surgically be treated as well. Another cause of recurrent pregnancy loss is thrombophilia. Women who have thrombophilia essentially throw blood clots to the pregnancy and therefore shutting off blood supply to the pregnancy and the pregnancy failing to continue to grow. Other types or causes for recurrent pregnancy loss include poorly controlled diabetes, thyroid disorders, or chronic medical conditions. Excessive alcohol use and drug use can also lead to miscarriages. Many times we'll do the entire testing and we will not find any source for the recurrent pregnancy loss. Do not worry, with appropriate testing and treatment, we can help the majority of women still have a live birth. I discuss more about recurrent pregnancy loss as well as fertility in my book, The Fertility Manual, Reproductive Options for Your Family. To learn more about me or my books, visit www.noorhasan.com. Please like and subscribe to my channel to learn more about fertility.